Okay, welcome everyone to the June 2026 monthly meeting of the Georgia One Health Consortium. So happy to see people here, and I know a lot of people will be watching the meeting on YouTube once we get it posted as well. But thank you so much for joining us live for those who were able to make it. We start off every consortium meeting with just a few fun announcements. So we'll get started before we talk about rabies in Georgia. So, first things first, I am so proud to tell you guys that we are up to 264 people who have signed up for the Georgia One Health Consortium. And these are folks not just from Georgia, but from surrounding states. As well as international folks. So really happy to see that the group is growing. We had a huge jump 2 months ago because of some recruitment efforts, and I'm just happy to say that since its formation in early 2025, we have not had a month where we've stopped growing. So it's still onwards and upwards. Also, Circle is our community engagement platform, and I'm happy to say that there are 80 people there now as well. Um, for those of you who don't know about Circle, I do like to remind folks that we have this engagement platform where you can see, other members. We have a member directory there, as well as post about your One Health events. Or maybe you just publish a paper about a One Health topic that you want to share. Or maybe there's like an article that you find fascinating. So this is the area where we go and we share all of the information throughout the Georgia One Health Consortium. I will also say, we fund this platform so that people can engage with one another, but it is an additional sign up. So once you have signed up for the consortium on our website, you then have to get a membership email. Like, you'll sign up and membership email will automatically go to you, and in that membership email is the Circle link to sign up for free. So if you have lost that email or you don't recall ever seeing that email, please drop me a line. I'm happy to send you that link. But the more people who can participate on Circle, the more fun it'll be. Also, if you are a part of an organization and you would like your logo to be on the consortium website, you are welcome to send it to us and we will get it posted. Again, the consortium is built up of so many people with so many different backgrounds. Of course, we have academia, but we have governmental, state and federal organizations. We have non-governmental organizations, grassroots efforts, community-based orgs, all who participate and make the consortium, what it is. So please, if you want your logo here and you don't see it, drop me an email as well. Just many thanks to our leadership team of volunteers. We have people who work tirelessly behind the scenes to help with facilitating the monthly meetings. I see Dr. Samples is here. Janet Hendrickson, who leads the People and Pets Project, has been super helpful with organizing our symposium, which I'll talk about. Dr. Hall from Berry College has been helpful, as well as Dr. Mercer and Dr. Comfer from Georgia Southern, who have just been great at increasing the numbers and just getting the word out about the consortium. So many thanks to everybody listed here. And of course, if you have, margin in your day and you would like to volunteer to help with the consortium, we're happy to have you. Now, this is the big announcement, and I'm just so thrilled to be able to sit here today and tell you this. We were able to get a symposium up and running this year. For those of you who don't know, we just formed the consortium last year, about the start of Q2. And then we held our first annual symposium in September of last year. And we didn't know if it would be an annual thing, but thankfully we were able to bring all of the, connect all the dots, bring all of the people together. And now I'm happy to tell you we are going to have our second annual symposium on September 24th through 26th. We did have it in Statesboro last year, and I hear, Georgia is quite a big state for travel. So we intentionally tried to find a more central location this year, and it will be held at Mercer University in Macon. This is the proposed agenda. As you can imagine, the team is hard at work behind the scenes trying to get this, launched, but it's going to follow a very similar agenda as last year, which is we're going to start with September 24th with an evening networking reception. So it'll have like heavy hors d'oeuvres, and we'll have an opportunity to come together, say a few words, and then just chat and catch up with one another. Then on September 25th, we're going to have an all-day event. It's going to be made up of panel discussions, keynote talks, interactive sessions, breakout groups. And new to this year, we're going to have a dedicated student poster area, exhibitor opportunities, and silent auctions. So really growing in breadth here, and just really happy to be able to provide this. Of course, if anybody would like to volunteer to assist in organizing these things, then we're always looking for helping hands. And then also new to this year is there is going to be an open house event or volunteer opportunity on the morning of September 26th at the People and Pets Project new building. So they're located in Macon. They hold regular One Health clinics that specifically, target low income individuals. And so we're just really happy to be supporting them this year. And they got the new building, and so we'll be holding like an open house event alongside this monumental occasion for them. So that is basically how it's going to be broken down. These dates are confirmed. I know we were kind of looking at save the dates a week earlier, but these are absolutely going to be the dates. So please mark them in your calendar. We're going to open registration in July in order to start getting, people's information in. Not quite sure when we are going to close it yet. That's going to be dependent on catering. And this year it will have a small fee. I am hoping to keep that fee super low. I know the first year the grant supported the symposium. It is our desire to keep the fee as low as possible, but there will probably be a small fee associated with attending, just to make sure we have, our breakfast and lunch and stuff, so we don't have to go out and try to find food. September 25th will be a long day for some folks. So that is the symposium as it stands, but definitely look out for more emails from me and from other team members, and information will start flowing. If you have students who you think would love to present some of their work in posters, just keep this event in mind. And we have not settled on a list of speakers. So if there are people here who are interested in speaking, feel free to reach out. We have people that, we would love to invite, and we'll be working through that agenda, but certainly happy to highlight consortium members as well. So this is my last slide before we move on to our speaker. Please continue to spread the word about the consortium. Again, it's constantly growing, and I'm so happy to see this growth. It truly is a statewide effort, and I'm happy to see us grow so much in just a year. So thank you. Join the Circle community, become active, engaged in the Circle community. And I think that'll be a really cool place to share if, it can get running. Continue to watch for consortium updates, reports, symposium registration, stuff like that. That's going to be coming out at a pretty regular interval starting in July. And our next meeting, a monthly Zoom meeting, will be on July 24th. Here's an email. If any of this appeals to you or you have any questions, feel free to reach out to us at ihla@georgiasouthern.edu. That'll come directly to our team members, and we'll be sure to answer any questions you may have about the consortium or symposium. So, without further ado, thank you for the opportunity to provide announcements. Before I turn it over to Dr. Samples to introduce our speaker, are there any kind of pressing questions about anything I mentioned? Is everybody super excited? I'm going to assume everybody with the camera off is just like, jumping up and down. But I really hope to see you in Macon. This has just been a fabulous group to work with, and it just leaves me so encouraged about all of the great work that's happening across the state of Georgia. So I'm just glad that we can move forward. So, okay, well, if you think of any questions, feel free. I'll be monitoring the chat, but Dr. Samples, I'll turn it over to you to introduce our speaker.
Well, good morning or good afternoon, everyone. I'm so happy to see such a robust group today. And what better thing to do and keep out of the heat than be here with us in the consortium monthly meeting. So before I introduce our speaker, I do just want to throw something out there. We have 1 month left that we do not have a speaker for the year 2026, and that is August. So if anyone would like to speak, or if you have an idea of someone you think would be a good speaker, if you could reach out to myself or Dr. Weezy, we'll be happy to work with you and get you on the schedule, or reach out to whoever you think might be a good fit, because we've only got 1 more month. We've been very successful in lining people up through the whole year. So let's make it 100% speakers this year. Otherwise, you'll be forced to listen to me talk about dead raccoons, and nobody wants to hear that. So today I want to introduce a speaker that's near and dear to my heart. He is one of my previous MPH students at Fort Valley State before I retired. He came to us from Nigeria. He's been here for several years, and he is now an employee with the Georgia Department of Public Health. Dr. Macdonald, Aloh, and he is going to be speaking with us today about rabies in the state of Georgia. So, Dr. Aloh, I'm going to turn this over to you.
Thank you very much, Dr. Sample, for that introduction. I've not been in the US for several years. It's barely 4 years in the United States of America.
Uh-oh, we can't hear you. Still can't hear you.
Still can't hear me.
Oh,
Shit.
right.
Now we
Yeah, we
can.
can hear you. Okay, now you're muted, so try to unmute. Okay, try
Is it
again.
good now?
Yes, perfect.
All right. Thank you so much, Dr. Sample, for that introduction. And I'm barely 4 years in the United States, so to me, it's not several years in America. Today, I want to talk about rabies in Georgia. And when Dr. Sample reached out to me for this presentation, I was wondering, how do I approach it? Because to me, rabies is a very large topic. Can you see my screen?
Yes.
So I decided to narrow it down a bit to rabies exposure management in the state of Georgia. So I want to put as a disclaimer, I'm not sent to do this presentation by Georgia Department of Public Health. I'm doing it on my own. If at any point you guys can't hear me, please let me know so that I will adjust. So in the course of the presentation, we're going to walk through understanding the epidemiology and pathophysiology of rabies, then how to perform a risk assessment, then we discuss the role of the health department and the hospital, and then take you from there to other questions. So why does rabies matter? Once someone start developing symptoms of rabies, it's most likely that nothing can be done at that point. So that's why the state of Georgia try as much as possible to prevent it before it occurs. As much as possible to start the pre-exposure prophylaxis before the symptoms set in, if there is any suspected case. So, but this is being achieved in America through the cooperation between the hospital and the Department of Public Health. So, tracking back a bit, rabies virus belongs to the family of Rhabdoviridae, negative sense single-stranded DNA. So basically it's trying to explain like it's a single-stranded DNA that needs to carry its own enzyme to replicate in the mammal's body because it will not be able to replicate without its own enzyme. It's bullet-shaped, enveloped. So in terms of pathophysiology, how it enters the human body, from the saliva of the infected animal, it will get to the nerve. Generally, it will start from the axon terminal and move backward down to the cell body before it now gets to replicate at the muzzle and make its way to the central nervous system where it causes its havoc. So one of the big things it causes is encephalitis. But when it causes this, that's now when it goes back to the saliva to infect the next person.
Yeah, I think.
So in terms of clinical presentation,
Thank you.
the incubation period is usually 1 to 3 months. But in most cases, if someone happened to have a suspected exposure, we are looking at if the animal is able to survive for the next 10 days, then we're most likely going to make the conclusion that it's less likely to be rabies if the animal is able to survive 10 days. Because if you understand what I explained from the clinical presentation, you need to get to that level of encephalitis before it starts showing on the saliva to infect the next person. And then person will generally present with fever, malaise, and then paresthesia. Little bit of sense of something tickling your skin when nothing is really happening. And then it will progress to hydrophobia. The person will not want to take water or see water near him or her. Aerophobia, which is very interesting because the person is going to be scared of having air currents around, become agitated, and then hypersalivation. Hypersalivation is more towards the side to try to infect the next person. That ends with paralysis and death. So just like I said earlier, once it becomes symptomatic, basically just little that can be done. So, but my focus today is going to look at what happens in the hospital versus what happens in the health department, because the management of suspected rabies exposure is a multidisciplinary management. You have to have the hospital, that the physician involved. You have to have the environmental health specialist from the health department have to be involved. And in some cases, the animal control will have to be involved. But the role of the physician will be immediate wound irrigation with soap and water, Then you have to assess the risk and the exposure history. I will give a deep dive about these assessments down during this presentation. Then you make the physician will generally make the decision whether to give a tetanus shot, depending on the person's medical history, and then determine whether the wound is big enough for antibiotic administration. And then we also make the determination whether this particular patient that is exposed need a pre-exposure, post-exposure prophylaxis or not. And then, very important, in the state of Georgia, anytime there is a bite that is suspected to be rabid animal, most of the times in the local health department, anytime there is dog bites or you suspect any contact with bats, raccoon, and the rest, as soon as you present to the hospital, they will have to notify the health department and then document the exposure. In determining whether the exposed person needs the post-exposure prophylaxis or not, if the person needs the post-exposure prophylaxis, how is it administered? If the person is unvaccinated, then we start with the human rabies immunoglobulin, which is like a passive, giving the person somewhat of a passive immunity, followed by the vaccine on day 0, 3, 7, and 14. If the person is immunocompromised, that's when we talk about giving the person the vaccine shot on day 28. Most of the times for people that have CD4 counts that are less than 200. But if the person is previously vaccinated, then you just have to give the vaccine on the 0 day, and that is day of presentation. And on the 3rd day, there will be no need for the human rabies immunoglobulin. Then the role of the environmental health. I know I made mention of the hospital signaling the environmental health. Okay, this person have rabid animal exposure, maybe a dog bite, the case may be. So that's where I currently work. This particular picture is a picture of a dog that I took this picture last week when I was called that the dog bit someone and I have to go and take the picture of the dog and get the dog quarantined. So basically what we do is to receive the bite reports. Most of the times it comes from the urgent care or the emergency department of the hospital. And then I will contact the patients and also the dog owner. When I get the address of the dog owner, then I have to go see the dog myself. So generally, the environmental health specialist in Georgia is expected to physically go and see the dog. Here in Monroe County, what we do is we quarantine the dog at home. We let the owner of the dog quarantine the dog for 10 days if the dog looks healthy. And this is because some people don't want to let go of their dog. So if you tell them you want to quarantine the dog, most of the times they freak out. So what we do is when we contact the dog owner, we discuss with them, like, we're not coming to take your dog, because already most people had the notion that the health department will come and take their dog if their dog beats someone or even beat them. So we try to work with the dog owners to get the dog confined within a particular space for the next 10 days, while we follow up, checking up on the dog until 10 days. And then we verify the vaccination record of the dog to be sure the dog have current vaccine and all that. If it's in the case where the dog is showing any sign of rabies, or we will not be able to quarantine the dog because the dog is aggressive or is a stray dog that will not be able to handle, then we may have to put the dog down and send the sample for testing. And at the same time, though I'm going to discuss about that down on the slide, how we now decide what we do for the beating. But all this, we have to document it in Sense. Sense is like a platform in Georgia where every single person that is working dog bites or animal bite relating to rabies, we have to record. It's a kind of a record keeping platform so that the physician can follow up with the case from Sense, while the environmental health specialist can also follow up with the case from Sense, and the animal control will also be able to follow up with the case. So it's a big platform in Georgia where everybody have to put in everything they've done towards this particular case. So I know this is a very complex table, but I tried to put it here so that we will look at it, how these decisions are being made about whether to give a post-exposure prophylaxis or not. So basically pay attention, did an exposure to rabies potentially occur? Very important. If no, we will not give post-exposure prophylaxis. If yes, then we have to. Did the mammal bite the patient? Very important. Did the patient have an open wound, broken skin, or nervous system tissue from the rabid animal? For instance, if the person have contact with the animal saliva and all that, if yes, we move to the next. If no, then no PEP. But if yes, then we look at what happened next. Is it a low risk animal, like a squirrel, a rabbit, or a mouse? If it's a low risk animal, then we'll not consider giving the rabies shot. If it's a high risk animal like the raccoon, fox, then we may look for the animal to know whether we'll be able to test this. If the animal is available for testing, then we can test the animal. If it's positive, then we give the shot. But if the animal is not available, we go ahead to give the shot straight. Now, if it's a dog, cat, and if the patient have the potential exposure, but the dog looks healthy, like this is the classical case of what we experience here in Monroe County. Most of the times, usually like a dog or a cat and the rest. So if the dog or the cat looks healthy, then we go ahead and quarantine, like I said. But if you cannot get hold of the dog, let me give a practical example. On Monday, there was a dog bite from a stray dog. Now, according to the patient, was walking down the street and then got bitten. Reported to the sheriff department. The sheriff department contacted animal control. The hospital contacted us. So when I got the reports, I said to contact animal control first, because I know most of the times they may have an idea of what's going on. So when I contacted animal control, they were like, okay, we are able to locate the dog owner. The dog has been confined, so I went to see the dog. So that's generally how we work on it, to see the dog and be sure the dog looks healthy, and then look at the immunization record and make sure the dog is quarantined for the next 10 days and follow up. So if you can get this dog quarantined, then there will be no need for PEP. But if no, or the dog does not look healthy, or the dog is not available, then we start the shots. But if the dog is not healthy, we can decide to test. If it's positive, we continue the shot. If it's negative, then we can discontinue the shot. So basically, that's how the decision is being made. But this table is most likely going to be used by the physician, because they make the express decision on whether to give the shot or not. So I'm talking from both ends, looking at it as an environmental health specialist and as a physician. In some cases, like they will be like, you need to contact the health department. But I'm going to say this out. The health department, to the best of my knowledge, does not make the express decision to give the shot or not to give it. The physician makes most of those decisions. But we can recommend that you can talk to your physician for possible shots to be considered. So the key note to take home: wash the wound immediately, never delay consultation when rabies exposure is possible. So most of the times, let me give this example. If you are in a room where there is a bat and you are not sure whether you have contact with the bat, we take it as serious as that suspected exposure. And if we have the bat to test, fantastic. We can test the bat and decide whether to give the shot or not. If you cannot get hold of the bat, then you may have to get the shot. So the prevention for rabies require correlation between the clinician and the environmental health. Another thing I want us to look at is human-to-human transmission. Even though if you're an environmental health specialist in Georgia, you are required to take the rabies shot. But human-to-human transmission has not been recorded in the hospital. Let's say you are caring for a patient that has rabies. There have not been any recorded healthcare transmission where it's transferred from the patients to the healthcare giver.
I do have a question, and this is something that's actually happened to us here where I live in Knoxville, Georgia. So you find a bat, it's hanging on your screen door. What do you do to get rid of it? And it's daylight, which is not a time when bats should be out. This actually happened to us, that we got up one morning, went to let the dogs out, and there's something hanging on the door looking at us.
Inside or outside?
On the outside of the screen, looking inside.
Okay.
And it's like 10 o'clock in the morning, so obviously not a time when bats should, normally be out. We normally see them down in our nursery catching insects in the evening when they're flying. But how do you get rid of something like this? Because obviously you don't want to be trying to touch it. Are there people out there that can remove them, or does the Georgia Department of Health come and remove them, or does Macdonald come out and remove them?
I will say this: if there is no history of exposure, it's unlikely that the environmental health department will come and remove them. Okay. But maybe if you call, we may get in touch with animal control to know what to do. But if the bat is inside the house and you were inside the house, then we must come out to get hold of the bat to get it tested. Or if it is a cat that you have an exposure with, and the cat is still hanging around, we are supposed to come and set up a trap to get the cat, take it down and get it tested. Okay. But if it's just outside running around, it's difficult for us to come out to get it tested.
Okay.
Any more questions? If I don't get a lot of questions, that means the presentation is not that interesting.
Yeah.
No, actually, it means you answered all the questions before we could ask them.
I do kind of want to open it up to other consortium members here and just say, Is there anybody here that works with rabies in Georgia, whether it's from like an academic perspective, or maybe you've done it in a prior, season of your life or whatever? Does anybody have any experience with rabies in Georgia? I
I don't
think
have
that,
any, yeah, I
yeah,
don't
go
have any
ahead.
experience with rabies per se. However, I do have experience with one of my dogs biting someone at the vet's office of all places. The dog was, she had dislocated her knee, and we scooped her up, took her to the vet, and I told him, I said, we were trying to walk her in, and of course she's walking real slow because she can only walk on three legs because, the knee is hurting. And one of the techs came out, and I guess it's Saturday, they get off at 12. It's 11 o'clock. They're trying to get everybody through. And she reached down and scoops the dog up to carry her inside, which was fine, except when she got to the door, the vet opened the door and said, "Here, let me take her," because the dog was kind of heavy. And when they tried to do the transfer, they must have twisted that knee or something because the dog got her right in the side of the face. And I mean, blood. And of course, the dog got dropped. And now the dog's running through the clinic, going crazy trying to find a place to hide. And of course, the girl had to go to the emergency room because it was a bite it broke the skin and it looked pretty bad. And of course, when she got to the emergency room, as Dr. Aloh said, the emergency room called Georgia Department of Health and said, "We got a dog bite." And now the dog was up on her shots. She used that veterinarian. It was our regular veterinarian that we use. So, they had records. But because it was a dog bite, on Monday morning, I got a call from Miss Carla Coley saying, "Oh, Rita, what's going on out there?" And I told her what happened. And I said, "The dog is up on its shots. This is what happened. She had a dislocated knee. And when they tried to transfer, she snapped." And she said, "Well, given the circumstances, and you're a vet tech, I'm just going to tell you to watch the dog for 10 days and I'll check with you in 10 days. And if the dog's not running around rabid, we'll call it a closed case." She said, "It sounds like it was a bad judgment call to try to pick the dog up when it was injured. They should have just walked it slow as it was and let it get into the clinic and then try to handle it." So, it ended well. And I have to say kudos to the Georgia Department of Public Health because they handled it in a very professional fashion. I too, when they told me when the emergency room said they were calling the Georgia Department of Public Health, I got that knot in my stomach that they're going to come and take Twix away.
Exactly.
And they said, "No, we don't have time to come and take Twix away. We're just keep an eye on her, and if she, start doing something weird, let us know." And that was pretty much all there was to it. It was a painless process for us. Now, it wasn't so painless for the tech. She ended up with two or three stitches in her face and a lovely scar to share for the rest of her life, and hopefully she came up with a better story than the one that got her the scar. I certainly would have.
Well, and
But
that brings up a really important point, which like, each state may respond in a different way. And I think that just highlights the value of the Georgia One Health Consortium, not meaning to like toot our own horns, but like having this talk from Dr. Allo and really hearing about how we handle it in Georgia and how that process looks is, very informative. And just checking in the chat, Julia said your presentation was very thorough and thank you for representing DPH so well. So that's
Thank
great.
you. Thank you.
There is a question. Says, in your area, which animals are most commonly responsible for rabies exposure?
So, in terms of testing, we normally used to have max, let's say, one or two cases of positive results. But I know we have gotten a result that is positive from a bat.
Mm.
So most of the dog samples we send for testing are not usually positive. So we have sent in some raccoon at a point. I know there was a time we did a small outreach with Dr. Sample where we sent like 25 raccoons out and they they freaked out. Where are these raccoons coming from? So, but I will say bats is a big one for us, but most dogs are usually, well, their vaccine record are usually current. So hardly have positive case from dog here in, let's say, central Georgia.
Mhm. Very
And
cool.
to follow up on that with what Dr. Aloh was saying, that was actually a funny case. I got a small grant from Morehouse to study um, zoonotic diseases in raccoons in the state of Georgia. And so the Burke County, which is over at Waynesville, Georgia, um, they have a DNR facility that is known for bird hunts. They have a lot of bird hunts over there, and it's actually the bird dog capital of the world. Well, they were getting every year in early spring to clear out the bird fields of the predators. They trap raccoons, foxes, anything that's an egg eater, because they don't want them coming into these fields and eating the eggs of there won't be anything to hunt as far as the bird hunt. So we had a ready supply of dead raccoons because the Georgia DNR traps them, and then the Georgia Department of Agriculture is there to kill them humanely. And then normally they just go on a burn pile. Well, we had them save the raccoons, and what we did was we harvested fecal material, we harvested brains, and we wanted to look at rabies as well as a gastrointestinal parasite I was interested in, Balisoscaris procyanus. So we went over, Dr. Aloh and another one of our students went with us, and we spent a whole day literally doing necropsies on 25 raccoons and sending 25 brains in and 25 sets of intestines to UGA. The brains went down to the lab that's down in South Georgia that does all of the rabies testing for the state. What we forgot to do, and it never occurred to me because I was working with the Georgia Department of Natural Resources, it never occurred to me that I should let the Georgia Department of Public Health there in Burke County know what we were doing, because when the rabies tests were finished, they came to me, but they also went to the Georgia Department of Public Health there in Burke County. And that man called me I'm madder than a wet hen, because his supervisor had called him and said, "Why didn't you tell me there was a rabies outbreak in Burke County?" And he said, "Because there's not." Well, we just got 25 raccoons sent in for testing. I'm looking at the results right now. So, and of course, he looks at the form, finally tracks down who I am and who Dr. George McCommons is, whose medical license we were operating under, veterinary license. And when he called me, it was like, "What the HE double hockey sticks are you doing?" And I told him, I said, "Excuse me, but not that it's any of your business, but we're working with the Georgia Department of Natural Resources." And I told him what we were doing, and he calmed down, and we had a very nice conversation. And he said, "Oh my God," he said, my supervisor is ready to fire me because he thinks that I tried to hide this." So I had to call his supervisor and tell him the whole story again, that no, your guy is not hiding anything. I assumed wrongly that the DNR and the Georgia Department of Public Health would have some sort of relationship and it would just get back to them. And he said, "No, we don't even, we do nothing with DNR." So we caused a little bit of a panic there for Burke County for about a day or two. But now here's the interesting thing. We all think about raccoons. When we think about rabies, everybody thinks about the raccoon as the first animal. Not one single raccoon had rabies out of 25 that we tested. So, I think there's something to be learned there, that the raccoon is not necessarily the nefarious carrier of rabies in every case. Not that we need to go out and make pets of them, but, just saying. Well, thank you, Dr. Aloh. That was absolutely wonderful, and you gave us a lot of interesting things to talk about and interesting things for people to consider around the water cooler later, because it's always my hope when we have speakers that while this hour we spend together is valuable, I think the time after that hour is even more valuable because people start thinking about it later or talking about it with other people. And so it spreads the consortium message even further after the Friday session is done. So thank you so very much. We appreciate it. If you are available or you are interested, as Dr. Swin said, we are having a symposium in September. You might be interested in speaking at it, or you might be interested in just coming and joining us for fellowship because it's going to be a lovely couple of days and we have a lot of fun. So just know that the door is always open to you.
All right. Thank you so much for the opportunity. I'm seriously considering being there since it's going to be in making here. So I'll most likely be coming.
Great.
Thank you for the opportunity. I appreciate it.